Okay, so we are live here now on YouTube. So yes, good morning everyone, all our viewers, and also of course for our today's expert dietitian Aditi. So today we have a wonderful topic, and it is about Dash diet. So I know many of you listening to Dash diet, many of you will be thinking that what is it exactly? So yes, we have today dietitian Aditi. So she is going to explain us what is Dash diet and how it is helpful. So yes, without wasting much more time, I hand over to you, Aditi ma'am, and you can continue with the session.
Okay. Thank you, Yogita. A very good morning, everyone. I am Aditi Mudliyar. I've done my master's in food science and nutrition. I have more than 5 years of experience, and I'm also a certified diabetes educator. First of all, I would like to thank Just for Hearts for giving me the opportunity to speak in front of all of you. And first, let's begin with what is hypertension. Hypertension is a silent killer, as you all know, because it does not show any significant symptoms, and but it puts you to higher health risk. Also, blood pressure is a common condition these days, and many people are not aware of the fact that they are suffering from it. Hence, for that purpose, DASH diet was developed by the researchers of National Institute of Health uh, to lower the blood pressure without using medications. So let's see some facts and statistics about hypertension. WHO rates HTN as one of the important causes of premature deaths worldwide. So now we know that HTN is a global concern. HTN is directly responsible for 57% of 70% of all stroke deaths and 24% of all coronary heart diseases deaths in India. In an analysis of worldwide data for the global burden of HTN, in 2005, 20.6% of men and 20.9% of women were suffering from hypertension. And it was estimated that by 2025, the men percent would increase to 22.9% and women to 23.6%. So that is a 2.3% of rise in men and 2.7% rise in women. And recent studies in India have shown the prevalence of HTN is 25% in urban and 10% in rural. According to the national level survey, which was conducted across 24 states and union territories, using 1 day fixed BP measurement, it states that every third adult is hypertensive. Now let's see what is DASH diet. DASH, DASH, stands for Dietary Approach to Stop Hypertension. It is a diet rich in fruits, vegetables, whole grains, legumes, low-fat dairy, poultry, lean meat, fishes, nuts, and oilseeds. It is a diet high in fiber and low to moderate fat. It is a healthy way of eating and flexible enough to meet the lifestyle and food preferences of most people, and hence the compliance rate is high. DASH diet emphasizes on the right portion size with a variety of food and nutrients. DASH diet also encourages you to lower the sodium intake in your diet and eat variety of foods rich in nutrients that lower the blood pressure, like that is potassium, calcium, and magnesium. Now let's see some facts and statistics of DASH diet. First of all, DASH diet is a research-based and it is recommended by various national and international bodies like the National Heart, Lung, and Blood Institute, American Heart Association, the Dietary Guidelines for Americans, and the US Guidelines for Treatment of Lower Blood Pressure. Then research has shown that if you follow the DASH diet religiously, DASH diet helps you reduce your blood pressure in just 2 weeks, and that too without medication. And over a period of time, the systolic BP could drop by 8 to 14 mmHg, and that makes a significant difference in your health risk. Then because the DASH diet is a healthy way of eating, it offers a great health benefits along with lowering your BP, that is reducing the risk of coronary heart diseases, cardiovascular diseases, strokes, uh, then decreasing your bad cholesterol, improving insulin sensitivity, and also having a healthy weight loss. So now let's see the sample. Yogita ma'am, can you please show the slide?
Yes, I'll just share it on the screen.
Yeah. Okay, so this is the sample diet plan of 2000 kilocalories. As you can see in the slide, there are 7 to 8 servings of whole grains, 3 to 5 servings of fruits, 4 to 5 servings of vegetables, 2 to 3 servings of low fat or non-fat dairy foods, 2 or less servings of lean meat, fish or poultry, 4 to 5 servings per week of nuts, seeds and legumes, and fats and sweets are in very limited quantity. Okay. Can you stop the slide, Yogita ma'am?
Yes, sure. I'll just, yeah.
Yeah. So this, I have a sample of what a dash diet includes. There are fruits, there are vegetables. It also takes care of the micronutrients. Like there's lemon, carrot, and beetroot. And this is a mixture of whole grains, nuts, and legumes. This is moong dal with skin. This is rajma. This is sesame seeds. This is flaxseed. This is peanut. And this is ragi, millets. Okay. So we shall now discuss a very important part of DASH diet, that is the salt. The salt restriction, the standard salt restriction is about 2.3 grams or 2300 mg of sodium, or a very strict restriction is of about 1.5 grams of sodium. So I shall tell you some tips and strategies of how you can reduce salt in your diet. First of all, avoid keeping the salt shaker on the dining table. Then when you start your day, measure 2.3 grams of salt. If suppose you are on a 2.3 grams of salt, on the diet of 2.3 grams of salt, measure 2.3 grams of salt, keep it aside, and use that salt in the entire day's cooking. Then avoid canned foods, processed packed foods, and also namkeens that you get in various packed foods, papads and pickles. Avoid cooking of rice without salt. Do not make chapatis using salt. Also, people have a habit of putting salt on when you eat apple, guava, or cucumber. So you can avoid that too. Avoid all ready-to-eat foods, instant foods like you get soups, salad dressings, and instant upma, instant Maggi noodles. You can avoid that. Then you can make the food spicy without adding salt using ginger and garlic. Then a very important topic, that is salt substitutes. You can use salt substitutes and make food healthy and also tasty without adding salt. So some of the salt substitutes are lemon, amchur powder, various herbs like rosemary, thyme, basil, and sage, oregano, etc. And condiments like cinnamon, cloves, and nutmegs, etc. Then a very important topic, and people are not aware of it, is the food labeling. You should spread more awareness about how food labeling should be read. As it is very important to know that many foods, almost all foods, have natural sodium present in them. But the processed foods, instant foods, ready-to-eat foods, processed foods, and packed foods have high content of salt in them. Also, baking soda, MSG, monosodium glutamate, MSG, soya sauce, oyster sauce, various sauces have a high amount of sugar, salt in them. For example, if you have frozen peas and canned peas, in which do you think will have more salt? Of course, the canned peas. And also buy food, if in case you need to buy packed foods, buy packed foods which has the label of no sodium or low sodium, very low sodium, salt free, or no added salt. Uh, then last but not the least, about the alcohol and caffeine, I would say that moderation is the key. American Heart Association says 2 drinks per day for men and 1 drink for women. And caffeine has no real evidence that it would really, decrease the blood pressure, but it has been seen by the doctors that caffeine intake temporarily increases your blood pressure. Also, you might face some challenges or practical problems when you are on a DASH diet, because DASH diet is so rich in fruits, vegetables, whole grains, and legumes. The fiber content of the diet is really high, and you may not be used to eating so much of fiber. So you may temporarily face bloating or diarrhea. You may have these problems. So what you can do is gradually increase the serving size in your diet, serving portions in your diet, and do not just abruptly like include in your diet. Then what else can you do along with the DASH diet? Uh, Consider increasing your physical activity along with the DASH diet, so that combining both will help you reach your goal a little faster. And American Diet Association recommends 150 minutes of moderate intensity exercise. That is about 30 minutes of moderate intensity exercise 5 days a week. Then who should eat this diet? Of course, people who are having blood pressure or who are at the risk of blood pressure should follow DASH diet, of course, but also because it is so healthy and so ideal way of eating, AHA recommends that everybody in the family of all age groups actually should follow DASH diet. Then can we have the last slide, please?
Yes, sure. I'll just share it on the screen.
Okay, now let's see what have we learned so far. Like a takeaway message for everybody. Maintain a healthy weight. Of course, if you're not sure what a healthy weight for you is, please consult a qualified dietitian. Then be active. I've just told you that 30 minutes of moderate exercise 5 days a week is enough. Then limit alcohol and caffeine consumption. Limit sugar intake. Take more of complex carbohydrates than simple carbohydrates. Then limit salt intake. All things you have to keep in mind: the salt substitutes, food labelings, avoid keeping salt on the table, etc. Eat variety of foods, which includes all the foods of all food groups. Eat cereals, preferably whole grains like barley, millets, sorghum, quinoa, bajra, jawar, etc. Eat more colorful fruits and vegetables every day. Eat legume-based dishes regularly. Eat unsalted nuts, seeds, and beans. This is very important. Usually the packet nuts we get are all salted. Then eat fishes at least twice a week. Consume low-fat milk and dairy products daily. And drink lots of water. And for a customized diet plan, please consult only a qualified dietitian. Thank you.
Yes, thank you so much, ma'am, for explaining us in such a brief about the DASH diet. So, yes, we have some questions from our viewers. So, I'll just dictate it to you. It is from Mr. Aniket Kulkarni, and he is asking, ki, can you please explain the intake of sendav namak in hypertension?
I think even the senda namak will have sodium in it. So the gram also, the how you measure, if you measure 2.3 grams even of senda namak, you can use that in your entire day's cooking.
Okay, so our next question is which foods are rich in potassium?
Uh, all fruits are very rich in potassium. All green leafy vegetables are rich in potassium. We have some nuts which are rich in potassium. Yeah, so fruits and all green leafy vegetables and otherwise all other vegetables are very high in potassium.
So, yes, we from our viewers, vegetarian, can I follow the DASH diet?
Sorry, I didn't get your question.
If I am a vegetarian, can I follow the DASH diet?
Yes, yes, of course. For the non-veg part of the DASH diet, that is lean meat and fish, of course you can substitute it with the DASH like the vegetarian sources for to replace the omega-3 and other things. But for that you need to consult a qualified dietitian so that he can give you a customized vegetarian DASH diet.
Okay, and yes, one more question. Can DASH diet also help in weight loss?
Of course, DASH diet is the ideal and the best way to have a healthy weight loss, and it is sustainable.
Okay, so it also helps in weight loss and also it helps in controlling our hypertension.
Yes, of course.
Okay, okay, we have a last question. Are there any other potential health benefits of DASH diet?
Yes, as I told you in my talk, that other than lowering blood pressure, it also reduces your risk of coronary artery diseases, all heart diseases in a common language, all heart diseases, strokes. The major cause of blood pressure is the result of blood pressure is strokes. It gives you a healthy weight loss. It increases your insulin sensitivity. It lowers your bad cholesterol. So these are some of the health benefits other than lowering your blood pressure.
Okay, so that was all with the questions from our viewers, and thank you so much for answering them so briefly. And I know they must have got cleared all about their queries. So yes, thank you so much for such a wonderful session, and also for the demonstration which you actually showed us that what we can use in diet in Dash diet. So thank you so much, and also thank you so much for all our viewers to ask your questions and to get your queries solved from our expert today. And also you all can subscribe our channel just for hearts, and you can also press the bell icon below to get the notifications of the upcoming sessions. So yes, thank you so much, ma'am, for such a wonderful session once again, and hope every all our participants also have enjoyed the session. So thank you so much, stay home, stay safe, and have a good day. Thank you.
Thank you for having me.
Thank you.